Indiana's first hemophilia gene therapy hub is launching in Indianapolis. And this is such good news. And I think they're going to help a lot of people. But we're going to get it broken down about what gene therapy is and how this could impact you from Innovative Hematology's Chief Medical Officer, Dr. Sanjay. Hello, Dr. Sanjay. Welcome.
Thank you. Thank you for having me.
Yes, absolutely. Well, let's just start off with what is gene therapy?
So, gene therapy is a type of medical treatment that help fix a problem inside the body's cells. So, our cells have genes, which are like instructions that tell the body how to work. Sometimes a gene does not work the right way or it's completely missing. So, in the condition called hemophilia, the gene is completely missing most of the time. So, in gene therapy, doctors give the body a new or working copy of the gene. So this helps the body make something that it was missing or not making correctly. So in example, in hemophilia, the body can start making its own clotting factor that can help reduce bleeding and may mean fewer treatments are needed.
So can you break down the condition hemophilia in case someone hasn't heard about it or maybe they are experiencing it now?
Absolutely. So hemophilia is a genetic disorder, and it's what we call an X-linked disorder, which means it's mainly manifested in males. Now there are some females that can be affected, but it's mainly seen in males. The condition is such that there are genes missing that make the clotting factor either factor 8 or factor 9. So there are two different types of hemophilia A and B. And if you are missing 8, you have hemophilia A. If you're missing the gene for factor 9, then it's called hemophilia B. In either of these conditions, so you're born with this disorder, and your ability to clot blood is severely impacted, which means that you can have spontaneous, for no reason at all, bleeding episodes. And the hallmark in this disorder is bleeding into the joints, so the knee joint, ankles, or the elbow joints, any joint for that matter. But whenever there's blood in the joint, it causes damage to the joint. Now, you have to give the clotting factor or the protein by an intravenous route. So the only way that it was available for many, many years was an intravenous route of delivery of this protein, which only lasted for a certain amount of time. So once you gave the factor to the person, it helped to stop the bleed and heal the bleed, but it only lasted for a certain amount of time. So repeated injections were needed. It lasts for the whole life. So it's a chronic, lifelong bleeding disorder with a tremendous burden for the patients.
Absolutely. It sounds like it. Wow. And so let's talk about this therapy and why is this a major deal for patients?
Yeah, so gene therapy is a big deal because it can change in general, how some diseases are treated. So instead of needing regular treatment, like I just mentioned, for many, many years, some patients may need only one treatment. So for people with conditions like hemophilia, gene therapy can help the body make what it has been missing. So this can mean fewer bleeding episodes, fewer hospital visits, less worry about getting hurt. It can make your life, leading the daily life, way easier. Patients may not need as many injections or medications. They can spend more time at school, work, sports, family, and friends like they should.
Yeah. And so why is this hub launching in Indiana and why now?
So now is an important time because gene therapies for hemophilia are now becoming available. These treatments were not an option before, but now some patients can receive them. Innovative Hematology is home to the state's only federally designated hemophilia treatment center, and we cover the entire state. And we have started the first gene therapy program for hemophilia and the hub within the state of Indiana. We are located in Indianapolis, but we cover the entire state. This means that patients can be checked to see if gene therapy is right for them and can get close to home.
Wow.
And within our center, we have a full team of doctors, nurses, and other experts that work together to care for patients. This makes it easier and safer for people with hemophilia to get advanced treatment without having to travel far away.
Yeah, I can't believe that there's over 33,000 people living with this blood disease in the United States. But you say that it it leans more male. Why do you think that is?
That's how the genetic disorder works. So it's called an X-linked recessive inheritance, where the gene for the disorder is carried by female but expressed in males. That's the particular way of genetic transmission, and that's why males are affected at a far higher rate than females. Now, there are females that we take care of that have the disorder, or they are carriers of it, but they can still bleed.
Yes. And so when people go through this treatment and they get the therapy, can you talk to me about what it looks like in their life? How are they feeling before, and then how are they feeling after?
Sure. So before, many people with hemophilia had to take regular treatments, often several times a week, sometimes two or sometimes three times a week. These treatments were usually given through an intravenous route, so into your vein to help their blood clot. We teach boys as young as 10, 12 to start finding their own veins, so that because it's a lifelong disorder, we have to teach them how to do their treatment by themselves. So they
Oh.
had to, and then they had to be very careful to avoid injuries because small bumps could cause serious bleeding. Many miss school work, miss school, work, sports, or time with friends because of the pain, hospital visits, or fear of bleeding. So that was all before. But now, newer treatments and sometimes gene therapy can greatly reduce bleeding. Some patients need fewer treatments after getting the gene therapy, or none at all, and they have to worry less about everyday activities. And this can obviously help them live more active, confident, and independent lives.
Yeah, that is beautiful, because I'm thinking about when you say constant bleeding. And so what are symptoms for people who may have this? And when you say they bleed out, is it from a joint? Is it from like nose bleeding? Like, what does it look like?
So all of the above, you can have spontaneous bruises, you can have nosebleeds, bleeding into the joints. Little kids, the males, when they get circumcised, they can have excessive bleeding from that. And when you have surgery or dental work, you can have excessive bleeding from those procedures if you don't give treatment prophylactically. So for lifelong, we give clotting factor or therapies prophylactically. That means we strive to prevent any bleeding. It is said that the least expensive bleed is the one that never happens,
Yeah.
because every bleed requires very expensive treatment and the complications that go from it. So gene
Wow.
therapy can, help resolve all of those, decrease it by 90% or more, and then, make life way easier for people.
Wow, that is a major deal. I mean, you're saying that people have to take treatments multiple times throughout a week, but this treatment, the gene therapy treatment, is a single application. Now, is this a single one time ever, or is this like a once a month ongoing treatment? And would you consider it a
Yeah.
cure?
That's a good question. So gene therapy is not yet called a cure.
Okay.
It can help many people with hemophilia have fewer bleeding problems, need fewer treatments, and some people may feel like almost like they do not have hemophilia for a while. But doctors are still learning how long the benefits will last. And yes, it is one-time treatment, but we're still learning how long the benefits will last. And the other thing is, not everyone with hemophilia can get gene therapy. So we check many things like age. You have to be an adult to get this, so above the age of 18. Your general health, liver tests, since this gene actually goes and sits within the liver cells, and that's where it makes the clotting protein. We have to make sure the liver is healthy and monitor it after gene therapy is given to make sure all the liver tests are normal. And also, it's only applicable to a certain type and severity of hemophilia. So in this case, you have to have severe form of hemophilia, which is a clotting factor less than 1%, or you're needing factor therapy on a regular basis prophylactically for a particular hemophilia called hemophilia B or factor 9 deficiency. We also look for antibodies in the blood before we give this kind of therapy. And a special care team is developed that helps decide if gene therapy is safe and right for each patient. We counsel the patients. A lot of follow-up is needed afterwards, at least in the first year afterwards. But once the gene settles in the body and when the less monitoring is needed, then you can go about your life and not to have many infusions afterwards, even for procedures sometimes.
Wow. That is incredible, and how exciting that this is all taking place in Indiana. And so, how would someone get in contact with you or start that process? Do they go to your company, Innovative Hematology, to apply and start off to see if they qualify?
Absolutely. So yeah, so we, as I said, we are the state's only federally designated hemophilia treatment center, and we are available 24/7. Our physicians are always responding to any phone call that comes in. And for gene therapy specifically, there's an email they can email directly to. It's genetherapyinfo@inhem.org, or call our center, which is 317-871-0000. And somebody would be there to help you out to see whether the therapy is right for you.
All right, perfect. Well, we will make sure we have that information shown on the screen. Thank you so much for your time, Dr. Sanjay, and your expertise. And I am just so excited about this innovative step that you are taking.
Absolutely. Thank you so much for having me.
Yes. And if you'd like more information about Innovative Hematology, we'll have their website listed below, in addition to the contact information that Dr. Sanjay shared to see if you qualify for this gene therapy test. That and more happening right after the break.